Diarrhea. Introduction. Chronic diarrhea is diarrhea that lasts longer than, choose one of the following options. 1. 4 hours. 2. 4 days. 3. 4 weeks. Correct. Diarrhea that lasts for at least 4 weeks is called chronic diarrhea. Dehydration is a serious complication of diarrhea. Select true or false. Correct. Dehydration can be serious, especially for children, older adults, and people with weakened immune systems. Tom has had diarrhea for the past 3 days and is starting to feel dizzy. Should he contact a healthcare provider? Select yes or no. Correct. Tom has had diarrhea for more than 2 days. Dizziness or fainting is also a sign of dehydration. Tom should contact a healthcare provider right away. Sally's 2-year-old daughter started having diarrhea earlier today. Her daughter is now crankier than normal and is crying without tears. Should she contact a healthcare provider? Select yes or no. Correct. These are signs of dehydration, which can be very dangerous in children. Sally should contact her child's healthcare provider right away. Diarrhea can be contagious when it is caused by infectious bacteria or viruses. Select true or false. Correct. It is important to continue drinking water when you have diarrhea. Select true or false. Correct. Drinking water helps prevent dehydration. You might also try special hydrating formulas to prevent dehydration if you or your child has diarrhea. All types of diarrhea can be prevented. Select true or false. Correct. Only rotavirus diarrhea and traveler's diarrhea can be prevented most of the time. Thank you for using Explain.